Joining us for our town hall. This is Christian Fellowship Congregational Church, 1601 Kelton Road. My name is Dr. Hill, and I serve as a senior minister here. We are delighted today to have with us Councilmember Monica Montgomery, who will be joining us just shortly as we have this conversation about coronavirus and its impact here in the San Diego community. This work has been led in large part by our Social Justice Ministry Board. We are asking that all folks who are here as participants, if you would just be so kind as to go ahead and mute your microphone so that we aren't hearing other conversations in your home and Sunday dinner being prepared. All right, so let us get going here. We give God thanks and praise for this opportunity that we have to be in conversation with one another as we learn and grow together for the good of our community. Brother Clovis.
All right, now I'm unmuted. Ladies and gentlemen, brothers and sisters, these are indeed strange times. We have not seen anything like this before in our lifetimes, neither in the context of a pandemic of this nature. We have seen things like Ebola and SARS, but they were largely contained before they got to anything like what we see today. We have not seen an outbreak like this since the early 1900s in terms of just health and the general public type of thing. We have not seen an economic crisis like the one we are in since the Great Depression. We can skip over the Great Recession of 10, 12 years ago. The Great Depression is what this is being compared to. Now, we have not gotten anywhere near that difficulty at this point in time, but if this persists, we will be looking at some great challenges. And so we want to be prepared. We want you to be prepared, and we want you to share with others the preparation that needs to be made to get us where we need to be. One of the stark realities that we have as a nation, and in many cases as a community, not taken a very hard stare at for the most part, is we have these conversations constantly, at least I do, about disparities in wealth with respect to race, disparities in health with respect to race, disparities in incarceration with respect to race. And we're having those conversations. We're doing work in those areas. We're making some gains in those areas. But the coronavirus has brought into stark relief the challenges that we as Black people face in the United States of America. When we look at all the things that have been happening for the last 401 years now, do we say that? 1619 to 2020, 401 years now, from slavery to Jim Crow to mass incarceration and to where we are now, where we now have an unusual lens, microscope on the plight of Black people in the United States of America. And this is 2020, not 1920 or 1820. We thought we had made it. We thought we had overcome. We thought we had really gone a long way toward where we imagined freedom to be. But now we see that that is not by any stretch of the imagination the case, where we see African Americans dying in multiples of other communities from the coronavirus. We see what the effect of mass incarceration is doing to our death rate within these institutions. And when we see how the impact and effect of disparities on our health becomes a critical factor in the pandemic and the crisis. And so we wanted to bring some information to you that we could share with you to prepare you for what is happening now and what is to come when we have entire nations, almost an entire globe on lockdown. But then we see interesting things like, I think it was Senegal, who has had only, out of I think 13 million people, has only one death, has a process for testing that costs $1. And so there are other things we need to be aware of and conscious of and take advantage of where and when we have the opportunity. So with no further ado, what I think I want to do first, do we want to go, Gloria, did you want to go first? Because I don't see, do I see Christie? I don't see Christie. So Gloria, let's let you go first and give us kind of the 30,000 foot view. And you'll need to unmute yourself. I can't do that for you. If you can do that, I can't unmute.
Okay, very good. So can everybody hear me? Yes, very good. I want to share with you an article from the New Yorker magazine that was published on April 16th of this year by a columnist by the name of Keeanga Yamata Taylor. Columnist Taylor just puts out a lot of facts in a relatively short fashion that make us think. So here we go. There is an old African-American aphorism: when white America catches a cold, Black America gets pneumonia. That's the old saying. And it has a new twist nowadays. When white America catches the coronavirus, Black Americans die. That's how serious it is nowadays. When white America catches the coronavirus, Black Americans die. Thousands of white Americans have also died from the virus, but the pace at which African Americans are dying has transformed this public health crisis into a lesson in racial and class inequality. Sometimes we think we are farther along than we actually are, but this crisis has taught us a lesson in racial and class inequality. African Americans are more likely to die of COVID-19 than any other group in the United States. And it is still early, very early, and the demographic data is incomplete, but the partial view is enough to prompt a reflection of American racism. For instance, Louisiana, which has more than 21,000 reported infections, has the largest number of coronavirus cases outside of the Northwest and the Midwest, the Northeast. When the governor of Louisiana, Governor Edwards, announced recently that it would begin to provide data about the racial and ethnic breakdowns of those who have died, he included the acknowledgement that African Americans, who are 33% of Louisiana's population, actually comprise 70% of the deaths. That is shocking, that is startling, and that is, unfortunately, the fact. Let's look at the city of Albany, Georgia, a relatively small town south of Atlanta. Once it was the site of a heroic civil rights standoff between the city's Black residents and the white police chief. And that was back in the early 1960s. Today in Albany, Georgia, more than 1,200 people in the county have confirmed COVID-19 cases, and at least 78 people have died. 81% of the dead are African American. 81% are African American. In Michigan, African Americans make up 14% of the state's population, only 14%, but we account for 33% of the reported infections and 40% of the deaths. What a disparity this is. 26% of Michigan's infections and 25% of the deaths are in the city of Detroit, a city that is 79% African American. COVID-19 is also ravaging the suburbs around Detroit that have large Black populations. The virus has shaken African Americans also in Chicago, Illinois, who account for 52% of the city's confirmed cases, but they account for a startling 72% of the deaths. These numbers, this disparity, it is a reflection of the fact that African Americans are more likely to have pre-existing health conditions that make the coronavirus particularly deadly. This is certainly true. These pre-existing conditions include things like diabetes, asthma, heart disease, and obesity. And these are critical factors, and they point to the persistence of racial discrimination, the disparity which has long heightened Black vulnerability to premature death. Here we are in the year 2020, and we are still talking about premature Black death. We're talking about the disparities, we're talking about the inequalities. Racism in the shadow of American slavery has diminished almost all of the life chances of African Americans, all of us. Black people are, unfortunately, poorer, more likely to be unemployed or underemployed, condemned to substandard housing, and given inferior health care, even in this day and age. These factors explain why African Americans are 60% more likely to have been diagnosed with diabetes than white Americans, and why Black women are 60% more likely to have high blood pressure than white women. And the statistics go on and on and on. And I still find it very difficult to believe that we find ourselves in the year 2020 and this is going on. Such health disparities are as much markers of racial inequality as other things like mass incarceration or housing discrimination. Meanwhile, no matter who is sunbathing at the beaches, we must remain focused on facts and standing on a foundation of faith. I am an optimist. I believe we will get through this, but to get the numbers down so that we are not overly represented in the deaths, we have to pay attention to those who are experts, those with the knowledge, not someone who is speaking off the cuff and passing on ridiculous notions. We have to pay attention to experts. We have to keep our faith, and we can get through this. That was just a little overview of the national implications of coronavirus.
And your timing is perfect, Sister Gloria. Thank you for that. And Sister Monica Montgomery has joined us. Councilmember Monica Montgomery has joined us. So that is a perfect segue into your introduction.
Okay, very good. Councilmember Monica Montgomery is known as the People's Council Member, and for that I am eternally glad. She grew up in the 4th Council District. She earned a bachelor's degree in political science from Spelman College and a Juris Doctor from California Western School of Law. The council member serves on several committees, including serving as the chair of the Committee on Public Safety and Livable Neighborhoods, and vice chair on the Committee on Economic Development and Intergovernmental Relations. She also serves on the Committee on Budget and Government Efficiency. Heaven knows we need more government and government efficiency, and on the Rules Committee. She's also on several other council committees. And we want to say again that she is known as the People's Council Member. So I give you, ladies and gentlemen, friends and family, our council member, Monica Montgomery. Hello, Council Member Montgomery. So nice to have you with us.
Oh my goodness, hello. It's really good to see you and to be with you all. I came in on the last part where we were talking a bit about the national implications and what's going on at the national level, which is abysmal. But we do have, I'm very grateful for our first responders here in San Diego and throughout the nation, our governor who, this is a very hard position for all of us to be in, including elected officials. And I think that, we're all trying to handle it the best way we know how. And this is a time where our values are truly tested. And so I do want to thank the regional leaders, the governor, essential workers who have been essential all along, but now get that title because of the position that we are in. Our community who has really pulled together in an effort to help one another in our time of need. So I do want to thank everyone for that. I know that I'm going to talk about some of the impacts on District 4. And I'm happy to take questions. I just want to give a quick overview, and just based on the position that we are in now, we are really building off of what has already been a rocky foundation for our most vulnerable and people in need. And so what this pandemic has done is really expose our inadequacy when it comes to serving our most vulnerable populations. And so I say that because we have done some things at the city that our intentions are good, but if we put those things on top of an already sort of rocky foundation. And so as the results start coming in from, say, our small business relief fund, and other things that we have done as the city, then the results are not as favorable as maybe they should be, because we were already working with a rocky foundation. So there is, I'm the same with you, as Gloria. I do have hope. I believe that we still need to take advantage of anything that is out there right now. There has to be a balance right now of advocating for what is right and true systemic change, and fighting within the system and trying to take advantage of whatever we can take that is out there right now. I don't think we have a choice. I think we have to do both. And so because of that, my office, what I have decided to do really is make a decision to play a role of trying to really help people get through these systems right now. What do I mean by that? Well, our office has an emergency communications protocol in place right now, to where we are closely monitoring our email and answering our phones, because people call wanting to know how to fill out the application for small business relief. They call with questions about how to get unemployment. They call when they want to look for jobs and need job portals. They call when they need to know where they can get food. And so we have really taken a role of trying to field a lot of those calls, because that is, there is assistance out there, and it really is about having the information that we all need in order to survive through this time. And so that's what we have been doing. Just a couple more quick things, and I'll open it up for questions. We do have, and this has been a topic throughout the nation, we do have inadequate testing capacity, particularly in our communities. I've been working closely with the county on this. We did have a testing site in our community on Saturday. We had a couple days to get the word out, but not a whole lot of time. So we're going to be working on continuing that. And right now, our county is still using the 211 system to connect people with these drive-through testing sites in order to get the referral to be able to get tested. So testing is not on a broad scope yet. In some places it is, in most places it is not. San Diego is not one of those places at this time. But we are continually working on that to try to ensure that we really get a handle and an idea of the community spread. Because we still really don't have an idea of that yet. The folks that are being tested are the ones that are the most sick right now. And so we're working on that definitely. Another thing is we have experienced significant job loss in District 4. Encanto is in one of the top 5 areas of the region that is experiencing the most unemployment right now. You have National City, you have San Ysidro, you have City Heights, Logan Heights, and Encanto. And so that is another very important thing to consider as we talk about unemployment benefits and food security, rent. So we're grappling with all of those things right now. And I will open it up for questions.
All right, Sister Monica Montgomery, thank you for joining us. We love you. I get to say that because I get to say that.
I love you too.
Thank you so much. So there was one question. I was looking at the questions, which I'm not looking at. Where are those questions I was looking at? That we were looking at. Here we go. So we are aware that there are disparities, and that I saw that Diamond, Family Health Centers, Diamond Centers helping out. But what is being done to address the disparate impact on people of color? Now, I know that there's only so much that you can do through your office. This is, I think, the health issues, of course, are county issues. But what can we look at in terms of how we can help, especially the church, to mitigate the impact on Black families and the Black community?
Yeah, I mean, that's a really good question. I think going back to, we will do the best we can to communicate the information to get it out, so that the church can kind of be another vessel of communication to get those things out to our communities. We're never doing enough, but I also want to take advantage of what we are doing right now. So, for example, yesterday, the testing site, I don't know that there was a big, as a matter of fact, we did talk to the health professionals there, and there weren't as many, they didn't conduct as many tests as they wanted to. And we know that that's an issue in our community. So somehow there's a disconnect. I believe it was based on the lack of time we had to get the word out, and the process that is still being used for testing, which is the 211 process. We definitely have to use those things, but it was something that not everybody knew. And so I'm gonna keep trying to bring those things back to our communities, but just getting the word out as church is very, very helpful. You all are doing that, and I believe you do have a food bank, food security, between when we first started, and it was announced that this was a pandemic and that we would probably have to shelter in place. The top two concerns that we got in the office were food security and our senior population, concerned about the mobility of senior population, and the senior population being one of the most vulnerable populations. So that is still definitely high on the list. Doing that outreach, making sure that our seniors are okay, doing what you're doing with the food bank, and staying connected with our African-American health professionals. They really give us a good idea of what's going on the ground. But I will also say this, that our Latino population is really struggling right now as well with the cases in Tijuana. And with this, it is, none of us can really go in our corner, and well, we're in our corners now in our homes, but it still has an impact. Where there is spread anywhere, there's sort of spread everywhere. So we have to, along with really focusing on the disparate impacts of African Americans, we really have to look at that whole picture, and make sure that we're doing all we can to make sure that the spread is not happening at a rapid rate. So the things that you're doing are awesome. Having seminars like this, you've got some great people coming on to give you different perspectives about what's going on out there. But this is really good, and staying connected. The county has their press conference every day at 2:30. At the very least, we can get the numbers from them. And then if we need to demand more from them, then we know what we're asking for. So that's also very important.
I have a question.
Yes.
Councilmember Montgomery, what is the county doing to address the increase in numbers around domestic violence and child abuse? I'm just wondering, is there any particular task force that's been established for this time when it seems like all around the country's numbers are rising?
Yeah, that is very true. A lot of, with the shelter in place, there's so much concerned about domestic violence, and also about mental health, and then about child abuse as well. I will have to get back to you, and I will connect with the county and get some of the numbers and relief that they have. They have been addressing this. I don't know if what they currently have in place is the best case scenario, but I will certainly get back to you once I can connect with the county supervisor and get that direct information.
Thank you.
Okay, there you go.
Okay.
So I want to honor your time. I understand, council member, that you have about 4 minutes before you have to go into another event. So if there is one pressing question that someone needs to put on the table, if we could just unmute everybody really quickly so we could maybe get to that one item, or if not, we will be happy to let you go early.
Okay.
Nothing pressing?
I will. So look, I'll just take 2 minutes, and then if someone chimes in with the question, I'm happy to answer. I do want to just remind everyone that this we're in the budget season. We are facing, on top of what we've already talked about, which is inequitable and disparate treatment, generally speaking, at the city for our community. We are facing additional severe cuts to our libraries and our park and recreations department. We have also a cut in one of the programs that works with young people through the police department, the Star Pal program. We have a lot of things going on. We have cuts in graffiti abatement, weed abatement. So, you know, all different spectrums. And so what we are going to be doing this week is examining the budget as a council, asking our questions, and then returning with our proposals about what the budget should look like. There is severe inequity in this budget. We have a lot of sort of mid-level management being kept, and then, you know, what I would call essential workers being cut. Also, right now at a time like this in our communities, it would be really, really hard to cut library hours in our communities right now. There's a lot of dependence on libraries in our communities. And so that, especially at a time like this, is going to be very, very tough. We also have received federal funding, that can supplement the work that we've been doing around COVID-19. It is very important that that funding is used to uplift our communities in a way that is per the restrictions and the guidelines that the federal government has given us. And that's in the tune of $248 million. So there's a lot to be discussed. We're talking deficits of upwards of $400 million. But we still have to prioritize that. We have funding going to Smart Streetlight program, but we have funding being cut when it comes to our libraries and our parks and our streets. In addition, our street money, you know, allocations are not fair. They're not equitable at all before this budget process. So it's gonna be a fight. Please stay connected with us so we can keep you updated, and we're going to discuss the budget hopefully at the end of the week with the community online, and we'll get that information to you.
All right, beautiful. Thank you so much.
Okay, thank you very much. Have a wonderful.
Councilmember Montgomery, one quick thing. I know I have to get you off at 1 o'clock.
Sure.
I want to support you and what you do. So when it comes to city council meetings, are those advertised on your website so that those of us who can come to city council meetings to support you and what you're doing? Because you're only one woman.
Yes, I am. Thank you for that. Right now, yes, you can absolutely call in. There's a new system that has been developed. So now folks can call into City Hall. That information is on the website, or if it's available, we can make it available to you. Right now, there is no congregation in the chambers, in City Hall chambers, based on COVID-19. But our city clerk has made a way for people to call in and the public to be heard on these issues. Tomorrow is a very, very big day. We are looking and diving into the police budget, the fire rescue budget for our firefighters and lifeguards, and the Office of Homeland Security, along with like purchasing, contracting. So tomorrow is a pretty big day. So, but there'll be these conversations all week long. So the schedule is there, the call-in information it's all there, and we can definitely send that to you directly.
Very good. Thank you, thank you, thank you. And we thank you for that extra minute that you've given us. Thank you.
God bless you. Thank you so much. Thank you.
Have a
Perry,
wonderful Sunday.
Yes, indeed. Thank you. Thank you, Perry Story, for helping with those arrangements, and for Sister Gloria for also helping to bring our council member to us. Let's go over to Christie Hill, who is, obviously very deeply entrenched in all the civil rights and civil liberties issues that go around San Diego, especially as it pertains to Black people. ACLU has been on the forefront of this, looking specifically and particularly into what's happening with our detained populations. So, Sister Hill, let me give you the floor to share with us the information you think is most important for us, and you got it.
Sure. Thanks, Clovis and Gloria. Gloria gave a good update about what's happening nationally and why we're seeing such high numbers of folks in the Black community being impacted by COVID-19. In addition to underlying health reasons, we can't, separate the conversation from racism that exists not only in the healthcare system, but in other systems. And so, one of the groups that the ACLU has been advocating a lot for are folks that are confined in jails and prisons and juvenile hall, or youth that are in juvenile hall facilities. Also, immigrants that are being detained in immigration detention centers. Here in San Diego County, we have one in Otay Mesa that has over 100 positive cases of COVID-19 so far. And so we know that just from what the medical community is saying about COVID, that it spreads easily, it spreads in confined spaces. And so jails and prisons and detention centers can become hotbeds for the virus. And so we have been, along with partners, advocating for folks to be released that are being held only because they cannot afford to pay bail, so have not been convicted of a crime, but are being held pre-trial. Folks that are at high risk to develop COVID, folks that are near the end of their time being served. So those are some of the categories. Last week, the 3 ACLU affiliates in California brought a statewide lawsuit to call on the governor and the attorney general to work on releasing those populations in jails and prisons and juvenile hall. And so we expect to have a hearing about that case this week. And last week, there was also a case filed, or the week before, a case filed about Otay Mesa Detention Center specifically, that would release folks that are being detained there in the same categories. And so we learned this past week that the judge agreed, and so ordered ICE to figure out how to release those in the high-risk populations, which based on information from is in the 60s. And so there will be a update about the ability of that facility to release folks tomorrow. In addition to folks that are incarcerated, we also have folks that are unhoused, that are without shelter right now. And in San Diego, based on figures that groups collect, it's estimated that 25% of folks experiencing homeless in San Diego are Black. And so again, the CDC is recommending, as are housing advocates, that you do not place folks in crowded shelters where they will not be able to socially distance. And that the police should not be enforcing and sweeping up encampments, because that will actually be more dangerous, not only for the folks that are in house, but also for the police and enforcing. And so you may have saw in the news that the County Board of Supervisors and Mayor Faulkner were touting converting the convention center into a mass shelter that houses over 1,000 people. That is not what we want to see. We want folks to be able to self-isolate when they need to. And so the state has provided money, and the county and city have all been acquiring hotel and motel rooms. And so housing advocates and folks who work with the homeless population are advocating that those rooms go to folks who are experiencing homelessness. There have been some set aside that have been allocated, but we need to increase those numbers. And then, we know that there were disparities in the way that police enforced our laws before COVID, and how the Black community in San Diego was disproportionately impacted by bias policing from the San Diego Police Department as well as the Sheriff's Department. And in COVID, we have to be cognizant. We've seen across the country of Black folks being punished for not wearing a mask, trying to get on public transit, and then another case for wearing a mask, trying to go grocery shopping. There was a report a couple of weeks ago from an assembly member here in San Diego, whose staffer, who was a man of color, was riding his bike to go to work, had on a mask, and the police stopped him, accused him of stealing the bike. And so we are, monitoring the enforcement practices. You may have heard about the protesters who were at Old Time Mesa Detention Facility in their cars. Some of them were cited because of that protest. And then, a week later, you have hundreds of people congregating downtown with no masks, not socially distancing, and not one person was cited. And so it's really important that we see consistent approaches, and we believe that the police should not be citing unless there is an imminent danger to that person or other people, just because the danger presented by COVID is so real. And I think that the discrimination that you see in the healthcare system is something that has been going on for many decades. And to touch really quickly upon how Black women experience that specifically. So there has been research shown that Black women, when they go to the doctor, regardless of socioeconomic background, are less likely to be believed about symptoms that they are, seeking care for. There was a case in New York, in Brooklyn. New York, as you know, is a hotspot right now for COVID. And a young Black woman, she's a teacher. She had been home sick with a cough, shortness of breath, and a fever. She sought help from urgent care, was told that it was just asthma. She, went back. She went to call the paramedics the following day. They told her that she was just having a panic attack. She then tried to go to a hospital, was turned away. And the next day, after that third attempt, she was on a ventilator. And so it's that type of just systemic bias that also makes it hard for folks in our community to get treatment. So we are so grateful to Councilmember Montgomery for being one of those voices to advocate for us here in District 4. One of the things that the ACLU and other groups have been calling on the county to do is to collect data that also includes information about race, so that we understand who's being tested, who's being hospitalized, who is dying from this, and who is contracting this. And so after we sent our letter with partners a couple of weeks ago, the county did start releasing racial data breakdowns for positive cases and deaths. We still have not received the information for testing and hospitalizations. We also asked for that data to be collected for other demographic categories, including whether or not someone is an essential worker, because we cannot manage what we don't measure, right? And so those are some of the things that we've been advocating for. So it was really great to hear that there was a drive-through testing site here in District 4 in Market Creek Plaza, or not too far from Market Creek, yesterday, and that some of the hardest, areas hit in San Diego County are in South Bay, and they also received some free testing sites. And so again, without having this information, the county and the city will not know where to invest. And so that's something that we've been working with partners to call on, and definitely, ask for folks to, reach out to your supervisors, participate in the upcoming meetings. On the ACLU's website, there is a COVID-19 resource page. And one of the links we have there are the public comment procedures during this time for all city council bodies in the region, as well as the County Board of Supervisors. And so you can go there, click on your city to see how you can participate during this time and how government is being done. So I will stop there. Thanks for the chance to speak.
So I think, I don't know if y'all can hear me. Can y'all hear me? Okay, so at this time, as we begin to wrap up, I would like to open it up to questions that folks might have, anything that may not have been answered that you might still have a question about. Of course, Monica Montgomery has gone. You cannot unmute yourself. You are unmuted by the host. Okay, here we go again. So are there any questions that people would like to put on the table that we can, if we don't have the answers today, we can research them and come back?
I have a question.
Yes, ma'am, go ahead.
Okay, I came in a little bit late, so can somebody explain to me what the 211 process is?
Anybody else have an answer? I mean, as far as I know, all you do is you pick up your phone, dial 211. It'll take you to 211, and then you can have a conversation with them about what your concerns are. They should be able to answer your questions.
Okay.
Christie, is there something more specific regarding COVID? Pastor, you're still muted.
Usually there's the countywide resources are listed on that number. You know, when on that recording, you can access the different county resources that's available to folks in San Diego.
I think it's actually staffed by live people though. And so if you are having symptoms, and we can get information from the council member's office to confirm this. But I believe that if you're having symptoms, you can let 211 know, and they can also direct you to where to get tested and to help with that referral process.
I'd like to share with you some information that I got from Councilmember Montgomery's communications director about the Budget Review Committee. Councilmember Montgomery advised that this is a critical week because there is budget review underway. There is a phone-in testimony period now open for item 2, which is public hearing on the fiscal year 2021 proposed budget. To call in and make your 1 minute of public comment on this item, you dial 619-541-6310. I will get this information in an email so that anybody who wants to phone in their testimony about the public, the Budget Review Committee can do so. And yeah, we need to support what Councilmember Montgomery is doing. And so certainly calling in for our 1 minute of testimony is something I hope that we all can do. Thank you.
That's an excellent idea. I also want to let you know, because we have additional security, I cannot post in the chat to everyone, but I've shared with Pastor, who may be able to share with everyone, a couple of websites where you can get additional information on what's going on in the city of San Diego on COVID. And of course, the county website, which I didn't post that one, but you can go to the County of San Diego. And almost any news outlet is the first thing you'll see on any of their web pages is going to be COVID, and it'll take you to the county website. Are there any other questions? If not, Pastor, can I turn it back over to you to give us some closing words?
Sure. We are just extraordinarily grateful and thankful that we have been able to get these resources into our community and to share them broadly. We continue to advocate for our communities, as well as, to hold our community as a whole in prayer. We are grateful to our council member for joining us, Perry, for your continued presence and the work that you do behind the scenes in order to make all of our community's work, our community better. And so we appreciate and value you. And to the members of Christian Fellowship, thank you so much for staying on and joining in this conversation. It will remain available on our YouTube page, and so you can refer back to it. And I also think that that as we continue to have these kind of town hall conversations, that if there are areas of interest that you are wanting to explore and have conversation with in this kind of forum faithfully, just to let us know for the Social Justice Board so that we can begin to coordinate and make these resources available. Thank you, sisters and brothers, for joining us today for worship as well as for this town hall. Let me offer a word of blessing and prayer as we get ready to depart from this sacred digital space. Let us pray. God, you know our needs before we can even ask them. You know our heart because you have created it. So we ask, loving God, that you will move upon our heart and our mind and move our hands so that we may find ourselves of use in this world to lift up those who are despondent and downtrodden and to stand with those who are marginalized and oppressed. Teach us the sacred power, oh God, of being neighbor to one another. We thank you, oh God, for our council member, for the gifts in which she continues to pour into our community. We ask, Lord, that you will continue to strengthen her and her staff, that they may continue to do the work that you have called them to do. We thank you, God, for Christie and for her advocacy work with the ACLU, as well as for Clovis and Gloria and Darwin in their work in coordinating this event for us. Bless us and keep us, oh God, until we are able to gather again. Through Christ our Lord, we pray. Amen.
Amen. Thank you,
Amen.
Pastor.
Have a great day, everybody.
Thank you. Bye-bye.
Bye.
Bye, thank you, guys.
Bye. Thank you.